Welcome to Sutures, an application dedicated to enhance the surgeon-patient communication about gastrointestinal procedures. This video is a part of a tutorial series to show you how Sutures works. When you open Sutures, the first screen shows a clear and simplified representation of a digestive system anatomy. As you see, we have the organs within a pink frame, which represents the abdominal wall. You can navigate in the workspace by touching the screen at any empty space and dragging your finger around. If you want to focus on a specific area or organ, you can pinch to zoom in or zoom out using two fingers. For instance, here I would like to show specifically the liver, so I zoom in to put it at the center of the screen. Now I zoom out to show all the organs. The intestines were programmed so they can mimic their real-life behavior. As in a surgical field, the small bowel is mobile. If you touch a part of the small bowel, you can move it by dragging it to the desired area. The same rules apply for the colon. But as you can notice, you cannot move the colon freely as you do for the small bowel. Please note the two little green lines connecting the colon to the abdominal wall. These lines allow to replicate the hepatic and splenic flexures, and you need to cut these green lines to be able to move the colon freely. There are other similar green lines between the liver and the abdominal wall, the spleen and the abdominal wall, the stomach and the spleen, and the pancreas and the spleen. They are here to help you reproduce the logic of surgery within the application. We will talk more about them in future tutorials. At the bottom of the screen, there are 5 buttons representing the tools that will help you to simulate surgical procedures. From left to right, you have the Cut tool, obviously to cut the organs, the Close tool, to close previously cut organs, and the Connect tool, to create anastomosis. At the right, you have 2 other buttons, the Add Tumor button that will allow you to add a graphical representation of the disease, and the Pathology box button to remove the resected parts from the screen. At the top of the screen, there are 2 inactive buttons. These are future exciting features that we are working on, and they will be available soon. In the next tutorial, I will show you how to use the tools to reproduce surgical procedures. Thank you for watching.